here is John Hickenlooper. Once again, gaslight, or no, I'm sorry. I just said John Hicken. Guys, this is my first day back after a week-long hiatus. I'm a little flubby today. I'm a little goofy. Lucy's here. All right. So Josh brought this to my attention, and I said John Hickenlooper. I meant John Delaney. John Hickenlooper has, of course, dropped out. Sorry for the misspeak there. Here's what John Delaney is doing, gaslighting people once again. Let's check out this video. Let me get the sound up for you.
All three of them are vulnerable for different reasons. I think Senator Sanders and Senator Warren, who I have a lot of respect for, I think they're fundamentally running on things.
He's talking about how flawed Bernie Sanders and Elizabeth Warren are. This guy doesn't even have 40,000 followers on Twitter. Every time he tweets something, his ratios are atrocious towards whatever he tweeted. I am a comedian who live streams a show from my living room. I have hijacked threads of his many times. I don't even remember how many at this point. But I have hijacked threads of his. I'm a comedian who streams a show from my living room where I'm getting my news on, where I'm seeing articles for the first time. That's my show. That's the show I do. And I can hijack a thread from a guy who thinks he's going to be president. This guy has a level of delusion that is, I mean, it should be diagnosed. Like, I'm sorry, it should be diagnosed. I mean, for this guy to entertain this fantasy that he has any chance in hell, he's humiliating himself. He's tarnishing his name forever. He's setting a horrible example for his family. And all because he has a couple $1 million invested in healthcare, which when you have 24 million, that's not a lot of money. When you got 24 million, 3 of it's in healthcare, and he wants to maintain the status quo because he wants other people to not get healthcare so that his stocks do better. How greedy can you get? Why not just take that 3 million, invest it in something else, John Delaney? Just invest it elsewhere. Everybody gets healthcare. You're still rich. You're that greedy and that short-sighted. What's wrong with you? Let's see if he tells us.
Is that a majority of the American people won't ultimately support.
The majority of American people already want Medicare for all. Bernie Sanders went on Fox News, got a standing ovation when he brought up Medicare for all. He gets applause and standing ovations in the heartland when he talks about Medicare for all. About 70% of Americans want it. Even in a Fox News town hall, everybody was for Medicare for all. Okay.
And I just think
that's why a bunch of Democrats are lying and saying they're for it when they're actually not. All right, moving on.
That's very, very dangerous. Things like making private insurance illegal.
It's not what it does. Not what it does. It makes duplicative insurance unnecessary. That's what it does. So it prohibits duplicative insurance. There will still be a private insurance sector for things that are not covered under a Medicare for all plan, which, by the way, Medicare for all isn't just going to exist in its current state. It's going to be expanded, and it's going to cover a lot more things. It's going to be a more extensive Medicare, and that's what we're all going to get. So duplicative insurance becomes unnecessary and void, so it's not around anymore. But there will still be a private insurance industry for stuff like Botox, stuff like elective surgery, things that aren't covered. Things that are elective, that aren't necessary. I might want to get the eye surgery. What you know what I'm talking about? The cataract, is that what it's called? The surgery where it LASIK. It's having a brain fart. I was like, what's it called? LASIK. I might want to get LASIK. There's a good chance that might not be covered under it. It probably won't be because it's elective. I don't need it. But I want to wake up and be able to see without having to put my glasses on. Someday I might get that. At the moment, I don't really have the budget for it, but if I ever have the means, I might go get that. It's come a long way over the years. That will probably exist in the private insurance market, even in the Medicare for all world. And I might want to look into a certain plan where it's like, if I think I'm probably going to do this, there might be a plan for that. There might be a plan. Hey, if you think you're going to get this surgery, you can buy this insurance plan so that it would be covered. Anyway. All right, so that's just not true, what he just said. All right.
For decriminalizing the border. I just don't think a significant majority of the American people are behind these things, and that's a problem. And I think the vice president hasn't really put forth a lot of new ideas. I mean, I think what we need in this election is we need new ideas for the challenges that we face, which are very significant. But we need...
So he wants new ideas, yet his idea is we just got to keep the health insurance industry around. He's calling for new ideas, and his idea is the status quo is fine. That makes sense. All right.
Someone who can actually craft solutions to these challenges in
which you have not done. You haven't crafted any solutions. You just parrot right-wing propaganda against the Medicare for All system because it hurts your stocks.
Ways that a majority of the American people can get behind them. So we need kind of a...
You drew 11 people at one of your events. 11. You have no enthusiasm whatsoever behind you. You have no supporters other than your own family. Your Twitter print is pathetic. So is all of your social media. All of your appearances, which you basically buy your way into, you just embarrass yourself. And whenever there's an audience involved, you get booed. Please tell me how you, John Delaney, know how to connect with the majority of Americans. You're doing a knockout job so far, let me tell you.
Pragmatic idealist. I don't think Senator Warren and Senator Sanders are putting forth pragmatic ideas. And I don't think Vice President Biden is reaching with big solutions that I think we need.
That's one thing we agree on. Holy shit. John, hey, a broken clock is right twice a day. And sometimes there's very strange bedfellows. That is the first time I've ever heard a sentence uttered from John Delaney that I agreed with. I like ice cream. Maybe he has said that at one point in time, and that's something that we both agree on. I too enjoy ice cream. So if he said that, well, there's another point we agree. But he just said Joe Biden isn't really thinking big enough. I actually agree there. Joe Biden thinks we can just do something about climate change by the year 2070 and we'll all be fine. So, hey, he's actually right there. In that 2.5 seconds, John Delaney said something right. There we go. Good job, John.
And we need someone who can fuse those two things together, which I believe I can.
No, you can't. No, you can't, because you have no ideas and nobody likes you and you have no self-awareness and you need to drop out. You need to drop out because the only reason you're doing this is to protect your stocks in the insurance industry. That's the only reason you're doing this. He knows that he has no plan. He knows that the stuff he parrots is just right-wing propaganda. Oh, if we have Medicare for all, it's going to close a bunch of hospitals. No, it's not. That's been debunked many times over. That's a Fox News talking point. John Delaney parrots it to protect his own stock. That's why. That's why he's doing it. John Delaney. Oh, and by the way, he used the word pragmatic there. We got to be pragmatic about this. That reminds me of a certain thing that I said at one point in time that Josh gave me a shout out on, which, Josh, thank you for doing this. Let's check out Josh. Your boy talking out his ass again. There's nothing pragmatic about an incremental solution for a catastrophic problem. And that was me. Thank you for that shout out, Josh. I appreciate that. Thank you very much. And John Delaney, I'll say it to you too. You want to talk about pragmatic solutions? There's people dying. Thousands and thousands and thousands of people die every year because of a lack of adequate health care, because they don't have access. They don't have the health care that they need. Well, they have access, but they don't have the health care that they need. And they're dying because of it. In the richest country in the world, that's a catastrophe. And there's nothing pragmatic about an incremental solution to a catastrophic problem. Take that home with you, John Delaney. All right. And thanks for the shout out, Josh. Much appreciated. Lucy, you're so precious.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your